Can neurofeedback improve focus while studying for college students with ADD or ADHD? Join me as I walk you through an experiment that was conducted to see if this is true. I believe that neurofeedback will help college students with ADD or ADHD focus better while studying. Many people may not know what neurofeedback is, why we use it, and why it's important. I'm here to break all of that down for you. Neurofeedback is a non-invasive method for retaining brainwave patterns through operant conditioning. It is used on people who have attention deficit disorder, ADD, attention deficit hyperactivity disorder, ADHD, along with many other disorders or head injuries. Neurofeedback aims to develop the skills for self-regulation of brain activity. ADD and ADHD are both disorders that many people have nowadays. Both are chronic conditions that begin in childhood and can follow you all the way into adulthood. Some symptoms that people may exhibit are inattention, impulsivity, and hyperactivity. That was just a little background on what neurofeedback, ADD, and ADHD are. Now let's get into the experiment. First, the participants consisted of 500 college students from across the country. The first 150 participants came from schools on the West Coast. The next 100 participants came from schools in the Midwest. The 100 participants after that came from schools in the South, and the last 150 participants came from schools on the East Coast. Of that, 250 participants were male, and the remaining 250 were female. The age ranged from 17 to 23 years old. Participants who were not of consenting age, which is 18, had their parent or legal guardian fill out a consent form allowing them to participate in the experiment. And for the participants who were of consenting age, were able to fill out their own consent form. Now let's get into the procedure. To determine if neurofeedback will improve how students are able to focus while studying, first participants will answer a questionnaire prior to the therapy. The participants will then go through roughly 15 to 20 neurofeedback therapy sessions over a course of 2 weeks. Data will be collected using test-retest reliability after participants follow up with another questionnaire after the therapy. Then the results will be compared to see if the level of focus has increased. Above is a picture of Thomas during one of his neurofeedback therapy sessions. The purpose of this experiment was to see if neurofeedback will improve the level of focus college students have while studying. Past research has shown that neurofeedback therapy does help people with ADD and ADHD. It improves one's attention, impulse control, processing speed, and variability in attention. If you look to the right, you'll see what some of Thomas's scores were after 20 sessions. First, you see his inattention levels have dropped, his hyper-impulsive levels have dropped, his learning problems have also dropped, his aggression has dropped, just to name a few. Just to reiterate, once the first questionnaire is completed, along with the therapy sessions, and the second questionnaire is administered and completed, the data will be collected and the results will be compared to determine if neurofeedback will improve the level of focus college students have when they are studying. To go back and look at Thomas's scores, you will see and agree with me that neurofeedback does in fact improve one's level of focus while studying.